From time to time, patients come in and tell us that perhaps they haven't flossed for a little while and they've tried to floss and their gums have been bleeding. Now it's tempting to think my gums are bleeding, so perhaps I should stop flossing. And it's natural to think that perhaps there's some damage being done and therefore you should stop cleaning in this area. But actually it's the opposite. If you see bleeding of the gums, in fact it means that this area probably needs a little bit of extra attention. So you can think of it a bit like going to the gym. If you haven't been for a while, at first it will probably be quite painful. But this doesn't mean stop going to the gym. It probably means you need to be there. And the same is true with flossing your teeth. So if you notice that there's a little bit of blood on your toothbrush or on your floss, or perhaps when you bite into some food, it's likely to mean that you might need a bit of extra brushing or cleaning attention in this area. So the main reason for gum disease is that there's plaque and bacteria that are close to the area, and the body's response to this is to send blood and inflammation to the region. So what you see visually tends to be red, shiny gums. They might look a little bit puffy, and of course you get the effect of bleeding. So we call this gingivitis. Gingiva is another name for our gums, and itis generally means swelling. So gingivitis is swelling of the gums, and what you see as an effect of this is that the skin in the mouth is thinner in this area and can bleed more readily. So generally, if we can clean the area where the gums are bleeding, the bleeding will go away completely within just a few days. But what if the bleeding persists? There are some other things that can cause bleeding gums. So sometimes it's a systemic illness, meaning that there's something else going on in the body, such as diabetes or perhaps a vitamin deficiency. Persisting bleeding gums can also mean that there's something deeper down in the mouth going on. For example, plaque or calculus, otherwise known as tartar, that could be caught in under the gums where you can't reach. So if you notice that bleeding is persisting, it's a really good idea to get an opinion from a dentist on what might be causing that. If we don't manage bleeding of the gums, the problem can get worse. So there's a condition in particular called periodontal disease that we're wary of in dentistry. So perio means around and dontal means tooth. Periodontitis is inflammation that occurs around a tooth. And the effect of this is that we can lose the supporting bone and gums. You might see sometimes that someone's had some shrinking gums, and you might even hear the term long in the tooth. So this usually means that the person has had some periodontal disease happen, where they've lost support for the tooth, the gums have shrunk away, and you can see more of the tooth, making them look longer in the tooth. So gingivitis need not lead to periodontal disease. If we can catch something early, we can generally manage it very easily. So the moral of the story here is if you see bleeding, this is your body doing what it's supposed to. It's a great early warning sign that something's going on, that you need to give it a little bit of extra attention, and if bleeding persists, make sure you contact your dentist.